This is Dr. Prashant Kerkar, and I'll be demonstrating the insertion of a central venous device, which is the portacath, which will be inserting for this patient for neoadjuvant chemotherapy. The part of my team is Dr. Azad, Dr. Sabreen, who's recording the video. So first, the various contents of the port. This is the needle that comes with the port. This is the catheter. We are currently using the detached version of the port. So we'll be attaching it once we insert the port. That is the chamber, and this is the introducer. And we'll be using it with the help of the guide wire. So we are showing certain landmarks here which we use for insertion of the port. This is the clavicle, and this is the area between the clavicular head and the sternal head of the sternocleidomastoid, and we'll be using roughly this point for the insertion. We can do it blindly as well as with the use of a sonocyte machine. See the artery medially and the vein laterally. With sonocyte guidance, we will be now inserting a 24 number 1.5 inch needle. Now we'll be using this needle, which comes with the whole set of the port. Now once we have pierced, we'll be introducing the guide wire. And the guide wire should go in smoothly without trying to use any resistance. So once the guide wire is inserted, we confirm the position of the guide wire with the use of a C-arm by locating the hook at the end of the guide wire if it's in the proper position inside the SVC. The site of the guide wire insertion is slightly widened to accommodate the catheter with the use of an 11 number blade. It is very important to make sure that there is no bridge between the subsequent catheter and the guide wire. The next step is creating the pocket for the chamber, which is roughly 1 to 1.5 finger breadths below the clavicle, and an adequate incision is made to accommodate the chamber. So the incision is deepened till we reach the pectoralis major muscle and its fascia. A small pocket is created superficial to the fascia to accommodate the chamber. The catheter is then mounted on the tunneler to tunnel this catheter from the subcutaneous pocket infraclavicular to the site of insertion. Then the catheter is cut at an adequate distance, roughly at the level of the manubrium sternum. Then with the use of 3 sutures, the port is fixed in the subcutaneous cavity by taking sutures with the pectoralis fascia. At the 3 ends of the chamber, which is stitched to the pectoralis fascia, is subsequently inserted into the pocket and the sutures tied. The next step would be putting the introducer over the guide wire, making sure that the part of the guide wire stays above the introducer. Without using much force, once the dilator is introduced, then the guide wire is removed and the catheter is introduced into the dilator. The dilator is gradually peeled off keeping the catheter in its position. The completion of the procedure is ascertained by putting Heplock through the chamber to look for ease of administration and as well as checking for backflow. The position of the portacat is then ascertained with the C-arm, looking at the chamber, the curve and the tip of the catheter using the C-arm.